Hello. Great to be with everyone today, and I'm really happy to be with you, KP. And for those who haven't met KP, you're in for a treat. I'd love for you to introduce yourself and InOn Health just to level set.
Great. So hello, everybody. My name's Kaakpema Yelpaala. I go by KP. I'm the co-founder and CEO of InOn Health. We're a company that's focused on improving health outcomes for multicultural and underserved populations in the U.S. We do that through a mix of consumer insights and omni-channel communications, so for patient and member engagement.
Awesome. And so you're not only an entrepreneur with a really impressive background, but you're also a thought leader in general on health equity, working in both the public and private sector. So I'd love to dive right into that, because health equity is something that is being talked about, a lot. But
right.
But you could argue, and I think you would argue, it's kind of a surface level conversation in terms of it's a buzzword, people are talking about it, but where's
right.
the action and the follow through to actually reduce disparities
right.
in health? So I would love to get your just starting with high level thoughts on what's it going to take to actually tackle this.
Right. So, health disparities are nothing new. And for those of us working in healthcare, they've been around for a very long time. I think in the current context with the pandemic, we now are kind of shining a light on some really deep and persistent disparities that we've seen in terms of not just morbidity, mortality. We're talking about real lives and people that aren't with us anymore. And so I think on the one hand, there is a lot of conversation about health equity, but I think from both a policy perspective and for entrepreneurs, we're still kind of navigating what it means. Like, I think if you ask someone what health equity is to them, you get, in a room like this, we get several different definitions. Mm-hmm. If we had a conversation about how we reduce disparities and how that ties to value, people might not have clarity. So I think there's still some work to do that we can talk about around moving to action and how we sustain efforts to reduce disparities.
And how would you define health equity?
So to me, health equity in its broadest sense is fairly straightforward. It's an aspiration that every person in our society or in our country should have the opportunity to have the best outcomes and wellness that's possible for them, right? And there's a lot that goes into how that happens, but that's the aspiration. And when you look at disparities, you can define disparities through different lenses, whether we talk about racial disparities, socioeconomic disparities, disparities based on so many different dimensions. And the work is to figure out how to level set and reduce those disparities and create more kind of better health outcomes for everybody.
And there's a big conversation to be had here, and you and I have talked a lot about, the lack of understanding within the industry, within sometimes the investor community, around also the economic opportunity to
right.
reduce disparities. And so it's almost thought of as, well, this is an area to make impact, but is there a correlation, is there an ROI there?
Right.
Which conceptually it seems, to me, of course. Right?
Mm-hmm.
This is the biggest area of need, the biggest area of cost. Of course, there's an ROI, but would love to hear kind of what you're hearing.
Right. As an entrepreneur that's working in this space, that's one of the cases that has to be made. That if we're working to reduce disparities, like how does that sustainably tie to value, and namely financial value? I think that there's an opportunity to not just talk about health equity as the right thing to do, but to understand that, whether you're a health system or a payer, these populations have a greater burden of disease. And that greater burden of disease ties to worse health outcomes and in the most direct correlation, much higher costs, right? And I haven't really seen the industry put out those type of reports yet. That's something that I want to see, because I think underneath it, that's what venture and other stakeholders are looking for is, well, what's the sustainable financial picture around reducing these disparities, right? Even if we start by agreeing that it's the right thing to do, as an investor, that's the other side of the story. Listening to the Chief Health Equity Officer for Humana yesterday, and also the Chief Health Equity Officer of United, they were on a Techquity panel, And they were really making this case that on the one hand, the disparities analysis that they do really is helping highlight the disparities through data, but that, for example, the Chief Health Equity Officer of Humana said it's very clear that those population pockets are where they have the biggest cost drivers, right? So if there are solutions that are intentional and tailored to that segment, it's not just doing the right thing, but it's driving financial ROI. I mean, I think there's work we can do as an industry to really highlight that, to unpack and demystify what it actually is to reduce disparities.
And you personally are doing this work in a number of ways. InOn Health is directly addressing some of these populations, but you also have a role in the public sector in Colorado. Maybe you can share about that as well, and kind of how you feel that could play
Right. So I live in Denver, Colorado, and last month I was appointed as the chair of the Colorado eHealth Commission. So I was appointed to that commission by the governor about 8 months ago. What that commission does is govern all health technology in the state of Colorado. So every stakeholder that you could think about that touches health tech is involved. So our health information exchanges, the Office of Information Technology, Department of Public Health, Healthcare Policy and Financing. And really the mandate, and part of why I'm passionate about that role, is that I have a mandate from the governor and lieutenant governor to focus on operationalizing what we're calling digital health equity and inclusion. And there are a number of kind of very targeted areas where we're looking to work vis-a-vis what our Colorado Health IT roadmap, which kind of lays a foundation for some different goals that we're looking to achieve in Colorado by 2024 around access to data and interoperability, around remote healthcare and making that more accessible in a few other domains.
That's awesome. And then, I'm just curious how you feel the public organizations like that, the public sector and the private sector, could work together.
Right.
How do you feel, what's the best path forward?
Like one very specific issue that relates to this is the issue of data. And these are conversations we're having at every level, I think, of the healthcare industry, whether it's entrepreneurs, federal government, state government, private sector. You can't sustainably change what you can't measure, right? And when it comes to health disparities, we have massive data gaps that are making it hard to get a clear picture of what those disparities look like. And those data gaps actually relate very directly to interoperability issues and how data is shared across the public and private sector. Just to give you a very simple example, we all know that maternal morbidity and mortality in the U.S. is really, really bad for Black women in this country. So we know that peer-reviewed literature is there, the data's there. But for example, in Colorado, when we look at how do we analyze that at scale across the state, there's just some very practical challenges. So the Department of Public Health sits on the birth registry. This is the source of truth for every birth in the state, right? Then you have your healthcare systems and other stakeholders that sit on other data. Then you have your health information exchange and other stakeholders. And while on the surface it sounds very simple, the way data is shared and governed does not make it straightforward to get access to the data that would give us a very clear picture of what those drivers of mortality and morbidity are. So that cascades through from the public sector to the private sector to an entrepreneur like me that is working on that problem, right? So that's why we really need to operate at those different levels of industry and of public and private sector, because again, without the data, how do we know that we're sustaining impact? How do we know that we're linking to reducing health outcomes? How do we know that we're reducing costs, right? All those things are data problems. So it's a really important issue.
It is, and it just seems really clear the way you're outlining it. You need the data to prove the ROI and the problem. The other piece that we haven't talked about is you need appropriate representation in the stakeholders,
right.
Whether we're talking about the healthcare stakeholders or even the VC community. It's no secret that most of the VC community, the most executives, are white males. And so, I think there's just a lot of links there in terms of understanding?
Right, like you just need diversity in the room. And so like in the Colorado context, that means both our multicultural populations, but also our rural populations. So I think one thing that's been done quite well in Colorado is that commission is representative of not just different sectors, but different issues, right? So when we think about health equity, there's a major issue in rural areas as well, right? And so we talk about representation across geography, across race and ethnicity, across type of stakeholder. But then also you want more diverse vendors, right? So a lot of what I'm focused on as chair of the commission is making sure that we have a representative set of vendors and thought leaders that kind of push the thinking in the right way and ask the thoughtful questions to make sure that the solution set that we're bringing to the table is diverse enough to actually solve the problems.
It's so important. And I also, because we're already short on time, I want to make sure you have a chance to highlight the great work that InOn Health, which you're the CEO of, is doing in terms of improving outcomes. And even during the pandemic, you guys have done amazing work.
Yeah, so I mean, this is a passion of ours, like, and you know, our goal is really to focus on this population. It represents a growing proportion of people in the U.S. Like my family's from Ghana. My parents were both Ghanaian immigrants to the U.S. I was born here. So on that dimension, I've had experiences myself and my family coming from a cross-cultural family and dealing with healthcare here. And we have so many diverse populations. So at InOn, our goal is to use kind of thoughtful approaches to how we engage. I think something you find in this space is people question scalability. So for example, if you have diverse populations and these diverse populations all need to be kind of engaged in slightly different ways, I think sometimes there's a question around how you scale those models. And I think that, you know, tech-enabled solutions that not only can leverage the best of tech, but also can meet people where they are in a personalized way is the only way that this problem gets solved. So the business models for this are going to look different. There's no AI-driven chatbot that reduces health disparities. It'll never happen. So if you're investing in that and you're thinking you're reducing health disparities, like you're going to lose, right? So the solutions that are going to actually sustainably solve the problem are going to be a mix of technology, and they're going to kind of leverage technology in the best way. But then the solution is going to be highly tailored, and that's really how our model works. So it's a tech-enabled service model.
Can you walk us through an example, maybe a case study of how a person would interact with?
Yeah, so I mean, there's kind of maybe one that I'll share in the COVID space, and then I'll share another in the kind of managed care space. But on COVID response, you know, we worked on the largest statewide COVID equity initiative in Colorado. And then we also worked on the largest initiative focused on creating access for Black Americans in Atlanta for testing and vaccination. The models were similar. So we call the model a connected community of care model. And this, you know, through the pandemic has, I think, become clear. If you want to engage a population and you want them to pay attention, it's first about trust, right? So you can send someone as much content as you want, but if they don't trust the sender, they're not going to engage. And so in our connected community of care model, on the one hand, we partnered with Emory in Atlanta to identify key organizations that were the best trusted messengers or trusted groups to engage Black Americans in Atlanta. Then we developed a content strategy that was relevant to the different issues and concerns of the population. Then we used data to determine where the biggest gaps were in vaccine access, for example. And when you look at those three things, then you tailor, let's say, a community engagement or tech-enabled communications model. The direct correlation is people getting tested or people getting vaccinated, right? And so we had some really good success at scale and also some significant ROI using that model. And I just use COVID because it's a space that we've seen really stark disparities. We use the same model at scale with Latinx populations and low-income folks in Colorado. And you can imagine this in many use cases. We have a use case with a managed care group in Oregon using the same model to help diabetics who have generally not engaged the health system or had appropriate care seeking, to get them to come in for the care they need and to ultimately reduce A1C, right? So use a very similar model using data, using health literacy and trust in terms of trusted channels, and automating different types of engagement strategies tailored to what those people respond to. And when you put in that effort, you get the result. You get the ROI, you get the better outcomes.
I love that you use the word trust so many times, because you're just really coming at it with such a human approach and understanding human behavior and leading with that, which I don't think all companies in your space do. So kudos to you. I could talk to you all day, but unfortunately we're out of time. How can people reach you if they want to learn more?
KP@InOnHealth.com, and you can reach me there or on LinkedIn, and looking for partners. We're really excited. We just won a partnership program with Froedtert Health System on community trust and literacy in Wisconsin. We're looking for partners that really are thinking about intentionality on how to drive these outcomes in the multicultural space.
Awesome. Thank you, KP.
Thanks so much.